what are some resources that exist that you can point folks to in the community?
Well, I really encourage them to come and see us at Roots. We also have a board that has on our website that has a lot of other resources in the community. We also reference, other clinicians and other groups. But one thing that we are doing at Roots, we're also expanding our just general groups, of like stress management. And I think what we have to do is ongoingly help people understand how they can manage the stressors in this community. We have to re-educate people on how we deal with conflict, and we're doing that at Roots. We're rolling out a whole new group for youth and adults.
That's amazing.
Yeah.
Yes, because in a lot of ways, it's a collective trauma that we end up going through every time there's a tragedy like this. We, of course, can't imagine what the family and the loved ones are going through, and just folks in the community, parents who worry for their children. So, yeah, not going through it alone.
No.
That's a key.
No.
And I think that's really why Roots ended up taking a real stand around community violence and saying we could never add enough behavioral health clinicians to keep directly meeting this type of tragic event with it happening so frequently. And I think that was a really big impetus for Roots to urge both the city and the county to declare gun violence a public health crisis, along with many of our community partners. And they did that. They declared it a public health crisis. They established the first ever Office of Violence Prevention in the county's history, and it's in the public health department, which we felt very strongly it should be, because we want to look at this issue from all sides and look very much at what are the conditions in the community, what are the resources in the community, what are the ways that we can build those skills like you were talking about to resolve conflicts, and also just to deal with the sheer amount of trauma that we're facing every day. And how can we look at all the things that lead to violence? Because it's not just one thing. There's so many different types of violence that occur within our community. And then as a result, there's so many different types of trauma that folks in the community end up experiencing. So we can't look at it as a monolith. It can't be only a conversation happening from the lens of enforcement. It really has to be around whole health, like what we call it at Roots, and just the whole community's health and well-being. And a lot of the work that we've been doing has led to us to ask and answer, what can we do at the community level, right? Because you can see patients and clients all day long. It's amazing to have not only individual, but also group interventions. Well, what else can we do out in the community? And so we've been having quarterly safekeeping meetings with residents of East Oakland. We have been training dozens with the intent of training hundreds in mental health first aid and just how to recognize someone's in crisis, how to de-escalate a situation. Our vision, I think, is to have at least somebody on every block that is trained in being able to identify and de-escalate and tap into resources. Because a lot of times we hear after tragedies, oh, I could see something was happening. There was this conflict, or this person was in trouble and we didn't know how to respond or how to react. And we just hate to hear that, because we feel like, was there an opportunity where we could have intervened? And so that's what we want to keep getting smarter and smarter about. And so we're also establishing a new venue within the community in East Oakland called Peace Committees. And so community members will be trained to help folks essentially work through different conflicts before they end in violence, before people end up in the carceral system or the court system or somewhere else, that we're able to actually manage our own conflict. So hopefully this gives folks a sense of calm and also a sense of being able to do something when sometimes it can feel helpless and hopeless. There's definitely folks out here like yourself, your team, and everyone at Roots, and so many partners and folks in the community that really want to see things improve.
That's why the work that we do at Roots is so vital, because it is at the community level. We know when we see things at the nation large, gun violence the narrative is not unique to the inner cities, and it's not unique, to our community. What I think is so beautiful about Roots and why I have been here is that we are meeting the community's needs right here on the ground. We see a problem, we doing just this, get out there and let's figure out what needs to be done. And that's what's so essential needed. And hopefully people can look and see what we're doing.